Well, hey there, Myo family, and welcome to this episode of the Myo Minute. I am Carmen Woodland. I'm an orofacial myofunctional therapist with a large online global practice, which means I can help you wherever you are in the world. I'm really excited to talk about this episode, which I have titled Orofacial Myofunctional Disorders, Parents Will Create the Change. So the reason that I'm really excited about this is because there's so much myofunctional impairment in the world. And I really think that parents are going to be the agent of change when it comes to rewriting the story of orofacial myofunctional disorders. So I think that the more that parents ask questions and demand answers, or aren't afraid to jump ship when doctors do wrong by them, I think that doctors will start to pay attention. So I truly think that if it hurts a doctor in the pocketbook, or if parents are honest about why they're leaving a doctor, then I think that they're going to take note. So, and I don't mean any of that in a bad way. I'm not saying like hurt them in the pocketbook, but sometimes practitioners don't notice that they're losing business until they start to see their numbers go down, or when a client is leaving an office and they are honest to say, hey, this is why I'm leaving. So I think there's a couple areas that we should start with and that we should talk about. This conversation is by no means going to be an exhaustive list. So first, let's talk about the topic of airway orthodontics. So if you are new to me, you're going to find that this is definitely a path of passion of mine, because children don't know any different. They don't have a voice, they don't have a dog in this fight, and I am their dog in this fight, okay? So on my website, there's a blog article called Airway Orthodontics, Become an Advocate for Your Child. And this lists some great questions that you can be asking your orthodontist or potential orthodontist. So there's some questions like, do you use retractive orthodontics? That's when they pull the face backwards rather than facilitating the growth forward and encouraging that growth forward. Do they extract teeth to fix crowding issues? My friend, when you pull small teeth, or when you pull teeth out of a small mouth, you create a smaller mouth. So that's definitely a big concern. Do you have a concern for mouth breathing? That's another question for the doctor. Do you look for tongue ties? Do they tell you to come back when your kiddo is 13 and has all of the permanent teeth? Because again, early intervention is the most important when it comes to airway orthodontics. And so if you are working with somebody and you're asking them this question and the doctor says, no, I'm not worried about mouth breathing, that is a real concern, because orthodontic treatment will not be successful if we have incorrect tongue posture, mouth posture, incorrect breathing, because that affects the development of the face, okay? And so it is not coincidental that I am seeing clients in their 60s and 70s that have had braces 4, 5, and 6 times. So there's a reason. So I really think when we're talking about parents being the agent of change, I think when you're asking the questions of the orthodontist, that's really going to be helpful, because I think you're going to force them to change or get up to date in their thinking. So let me give an example of an exam that I did recently. And it was somebody who was referred to me from an orthodontist. So I was really excited that orthodontist was finally starting to get it, because I had been after them for quite some time to really take an airway focus and to start looking at ortho a little bit differently. And so they referred somebody to me. Again, the classic referral from an orthodontist is to fix the tongue thrust. So this particular person was having trouble, had gaps in between the teeth, was starting to have an open bite, which is where the teeth don't come together, and the orthodontists wanted me to fix that. Now the interesting thing is that this person had a really strong tongue thrust swallowing pattern, but that orthodontic practice wanted to sell her on Invisalign before she did myofunctional therapy, and the orthodontist told this lady that if they didn't close those gaps, that she would not be able to learn how to swallow correctly. Wrong. That's wrong. Okay. There's no delicate way to say that that's a bunch of BS. And I don't think that it's meant I didn't think that they meant it to be wrong or ugly or anything like that, but it's just wrong. You guys, you could have gaps between all of your teeth big enough to drive a Mack truck through, and it's not going to affect your swallow. Okay? I can tell you that beyond a shadow of a doubt. So in this situation, this was an orthodontic office, clearly did not understand anything about swallowing, myofunctional therapy, any of that stuff, because quite honestly, the answer for this lady is, friend, you need to fix all of this stuff before you even think about straightening these teeth. And that's what I feel like a good airway focused orthodontist would have done. They don't straighten teeth, they fix the mouth breathing issues, they fix the tongue rest posture issues, they fix the open mouth resting posture, they fix those things before they cosmetically straighten the teeth. So another thing that I'll touch on here, I talk a lot about this on all parts of my social media, is the conventional versus the airway focused. I think when parents ask questions about this, they're also going to be the ones who force the change. The thing to know and understand, if you're a parent wondering about this, an airway focused orthodontist looks at you as a whole, looks at the structure, looks at the bones, looks at the bones of the house, the foundation of the house. They don't worry about putting beautiful furniture in there, which is what a tooth beautician does. So that's a cosmetic or a conventional orthodontist. So those people just get the teeth looking nice. They don't care about the rest of you. They don't care about the airway. We want people who have balanced faces. We want our children to have adequate airways. We want them to have good quality sleep. And believe it or not, those things all tie together. So I'll tell you this, it's not cheap. So don't focus on price because a good airway focused orthodontist is going to be a little bit more expensive. So that just kind of gives you an idea. I want you to understand that before I go asking you to say, hey, help make waves, help make change. So my advice to you is to start advocating for change. And this is when I'm saying, hey, help me be the agent of change. Encourage your doctor to become cutting edge. They can reach out to me. They can get questions answered. There's a plethora of information out there. There's the AAPMD. They can take a course somewhere. Anything. A lot of doctors are going to the Breathe Institute to be trained with Dr. Zaghi. There's tons of options out there. But when you start asking your doctor questions, when you start second guessing them and just really going with your gut feeling, I think that's going to force them to say, hey, maybe I need to change here a little bit. And don't be afraid to get 2, 3, 4 opinions when it comes to things like airway ortho, because sometimes that's what it takes to hear what you need to hear somebody say, hey, this is a concern. We don't want to wait till your kiddo is 13 to address this. We want to address it when your kiddo's 3, 4, 5. The American Orthodontic Association, I don't know if it's still the case anymore, but it used to be that they recommended that you have a screening by age 7. Well, any orthodontist in the airway world is going to say that's a geriatric patient, because by age 7, there's facial development changes that are already happening because of mouth breathing, low resting tongue posture, that kind of stuff. And the last thing I think, you guys, that will help facilitate change with your doctors is be frank. If you're leaving an office because they want to pull teeth out of your child's face, if you're leaving an office because they tried to sell you on an expansion appliance but never commented about the severely recessed mandible or that kind of stuff, if you're jumping ship, let them know why you're jumping ship, because I think that it's going to take the parents saying, hey, this is not okay. I think it's going to take the parents being the ones that say, we really demand that you get up to speed and that you are a little bit more knowledgeable. So I hope that helps. I always have so many thoughts about this, how parents are going to be the ones. I have said this time and time again that if you just piss off Mama Bear, she is going to do anything to protect her cubs. And I think this is that exact point. So really the topic of tongue ties, airway, those type of things. If you think something is wrong, don't let your doctor say, hey, you're crazy. This is totally normal. Get more and more opinions. and encourage them. And then when you do learn something about it, share it with your doctor so that they can perhaps broaden their knowledge. So I hope that was helpful, you guys. If you are a human that has myofunctional concerns, mouth breathing, tongue posture problems, digestive issues, poor sleep, you're not breathing right, you've got pain, chronic anxiety, depression, all of those things, or you have a kiddo that has concerns, the best place for you to start is with an exam. That way we can evaluate symptoms. How can I help you? We get a team together. Who do we need? When do we need them? What order do we need to do things? So there's a lot of moving parts. That is the best place. So I know where you're watching this video, you'll have the opportunity to make your way to my website to be able to schedule an exam. And then last, help me make impacts on more lives. That means share this information, tag somebody, send them the email, send them the link, because this is not mainstream. 17 years from now, when there's a paradigm shift, it actually will be. But in the meantime, help me make a difference. So that's it. I'll be back next time and we'll talk about another hot topic. Bye for now.